One of the big differences between a sleeve and the bypass is kind of expected excess body weight loss. And so we use this term a lot. So if somebody has, say, 100 pounds to lose, with something like the gastric bypass, about a year and a half out, we expect them to lose anywhere from 80 to 85% of their excess body weight. So that'd be 80 or 85 pounds. With a sleeve, we would expect them to lose about 50 to 60% of their excess body weight. Again, 50 or 60 pounds.
And to be honest, between the two surgeries, I often get questions about, which one's more invasive. And I really want to reassure you that because these are done in a minimally invasive fashion, a lot of complications or potential risks with both surgeries are identical, especially around the time of surgery. And we'll talk to you more about what those are. These are both very safe surgeries, even though technically they are done in a different way.
And I'm glad you brought up that point because the reality is I would say that the bypass is a more technically demanding surgery. But it is also a surgery that when you do a lot of them, it becomes very straightforward for that surgeon. And that is a little bit different from the sleeve, that it's a little bit technically easier to perform. But that doesn't, as Dr. Kajese say, propagate into more risk up front. There are issues with the gastric bypass that can happen down the road, and we'll discuss a little bit more about that in other videos. But those issues, thank goodness, are limited to less than 5 to 10% of those patients.